I'm going to begin with a quote from Gabrielle Giffords' recent speech she made this January on the 3-year anniversary of the shooting in Tucson, Arizona. She said, "Congress needs to extend mental health resources into schools and communities so the dangerously mentally ill find it easier to receive treatment than to buy firearms." Giffords continues to fight for the mental health resources to be readily available and accessible by the public. And the AOTA continues to fight to make occupational therapy play a larger role in this mental health field. Mental illness has caused devastating events in our society recently, from the Sandy Hook shooting to the shooting during the Batman movie, both in 2012. Many blame the current violence on the fact that people with mental illnesses are not able to access mental health recovery centers easily enough and do not receive the length or quality of treatment they deserve. This is where our profession comes in. Occupational therapy can make a difference. We have all the education, resources, and abilities to play a larger role in the mental health field in our future.
The therapy cap is a Medicare policy that places a limit on the dollar amount that each consumer can receive coverage for in outpatient therapy services. Up to $1,920 is covered by Medicare for outpatient occupational therapy services. An individual may qualify to get an exception from the initial therapy cap. If Medicare decides to cover more outpatient therapy services, they will cover no more than $3,700 for outpatient occupational therapy services. The Medicare therapy cap is an annual per beneficiary cap. At the start of the next year, the dollar amount is reset back to zero. In the world of occupational therapy, AOTA fully supports the repeal of the outpatient therapy cap. It is our belief that Medicare beneficiaries have access to proper care in order for patients to maximize their function in order to be as independent and as productive as possible.
The Affordable Care Act is the biggest thing to happen in healthcare reform, and it is happening right now. Not only will people without coverage be able to become insured, but it also has an enormous impact on us as occupational therapy practitioners. As the healthcare system shifts from the paradigm of don't fix it till it's broke to a new preventative health focus, we as occupational therapists must capitalize on this opportunity. Let's look at insurance companies. They aren't necessarily going to cover preventative care, but they are shifting from a fee-for-service reimbursement model to a value-based purchasing model. This means that they will incentivize hospitals in order to increase desirable behaviors such as using resources efficiently, provision of high-quality care, and achievement for good patient outcomes. For example, Mrs. Jones is admitted due to a hip fracture because of a fall. She goes to therapy and is eventually discharged. The hospital receives full reimbursement for service if Mrs. Jones doesn't come back with complications. Now our role in this is to provide excellent, best practice, client-centered care. Occupational therapy has a key role in prevention, and it gives us an opportunity to broaden our scope of influence in physical rehabilitation.
Due to the baby boomers and increase in longevity, the number of older adults is expected to double to 72 million by 2030. As the population of older adults continues to grow, home modifications are a key factor in enabling individuals to age in place. In a recent AARP survey of Americans aged 50 years and older, 88% of respondents reported that it is very important to have long-term care services that allow aging in place. However, only 1 in 6 homeowners has made home modifications that would allow them to be safe and comfortable in their home as they age. In 2011, President Obama signed the National Alzheimer's Project into law, which is a national plan to combat Alzheimer's disease with the same intensity as previous plans to fight AIDS and cancer. Working with clients with dementia is not necessarily new to the profession, but with the estimated growth in cases in the next few decades and the evidence that occupational therapy can improve the lives of people with Alzheimer's disease and their caregivers, the need for occupational therapy services will expand. Occupational therapy practitioners are the only professionals who possess a tremendous amount of knowledge in the areas of occupational analysis and performance that are necessary for addressing driving and community mobility. Another aspect of knowledge that is sometimes overlooked is low vision. All occupational therapy practitioners who work with older adults will have clients with visual impairments, and they do not need to work in a specialized clinic to address visual needs.